Many of us don't notice the most insidious little defect on a tooth, which can lead to cracks, chips, and pain. It constantly, but imperceptibly gets bigger. Over time, sensitivity to cold and hot appears, and the gum starts to recede. This causes a lot of problems, complicated treatment of cavities right at the very base of the tooth. If you ignore it, the tooth can simply fall out. I don't think you'd want to lose a tooth because of a tiny notch. If you agree, give this a like. You may have noticed this notch before but didn't pay attention to it. You probably thought this just happens with age. Actually, that's not true. It's possible that you yourself are making it worse every day, just without knowing the reasons. Some people think that the appearance of the tooth will suffer a little, but it's no big deal, and then sensitivity appears. In this video, I'll briefly and to the point explain which of your daily habits cause this defect, what happens if you ignore it, and how to quickly get rid of it. Pause the video right now. Check yourself in the mirror. Do you have any such defects on your teeth? Most often, it's the canines and the teeth around them. If you find such a defect, please write defect in the comments. I'm really curious to know how many patients like this are watching us. What will happen if you don't fix this defect? Let's imagine you found it in the mirror, watched this video to the end, closed it, and went about your business. Had something to eat, went to the bathroom, took a shower, went to bed with your loved one, and in the morning you woke up and didn't even remember watching this video. About a year later, you'll remember this video because most likely your tooth will start to hurt. And if it does, it means that your surface indentation has turned into surface caries and has started to penetrate inside the tooth. It's still nothing too serious because the caries is only on the surface. It hasn't reached the root of the tooth yet, it's only gotten as far as the dentin. This is the soft, inner, sensitive part of the tooth. At this stage, it can still be treated relatively easily. But if for some reason you don't make it to the dentist and instead start drinking less hot tea, avoid cold foods and sweets just so your tooth doesn't hurt, then in another year, the caries will definitely reach the root. The tooth will start to hurt much more, and treating it will take much longer and, most importantly, will be more expensive. At this stage, I can say with 99% certainty that the root of the tooth will have to be treated. And when you treat the root, it means the tooth is already dead, and a dead tooth, which no longer receives nutrients, usually starts to darken and break down faster over time, becoming more brittle and susceptible to cavities and, most importantly, to mechanical stress. So when you eat, you can actually break it. Such treatment will cost 2 or even 4 times more. Of course, it can even get to the point where after the root, the entire area around the root and even neighboring teeth or roots of adjacent teeth are destroyed, and such a tooth cannot be restored, it will have to be removed. I'll explain how to restore a single missing tooth in my next videos. Subscribe. I hope it hardly ever comes to that, and it's rare, but it's much more likely that you'll need to get a crown on such a tooth. For that, you'll have to have the entire tooth ground down from the top, and it will definitely last less than your own healthy tooth. Getting a crown will already cost you, well, about 50,000 rubles. I'm sure you just listened to me and thought, I'd rather not let it get to the point of needing a crown. If that's how you feel, then next I'll explain why such defects appear on teeth, how your small daily habits lead to this, and how you can quickly and, most importantly, inexpensively treat such a defect or cavity. Now I'll explain why such indentations or defects appear and how to prevent them so they don't show up on your other healthy teeth. The first main reason is improper brushing, or more specifically, using the wrong motion with your toothbrush. When we brush our teeth, we often use what's called horizontal movements. By the way, these kinds of movements are even shown in commercials. You often see this on TV, and people mistakenly think that teeth should be brushed with these horizontal sweeping motions only. That's why horizontal movements lead to us wearing down the enamel, especially in the cervical area, which in turn causes these kinds of defects. The cervical area is the part where the tooth meets the gum. Incorrect toothbrushing leads to quite a number of consequences, so be sure to watch the video on my channel about proper toothbrushing, where we explain in detail and step by step how it should be done. The second cause of such dental defects is bruxism. In everyday language, this is called teeth grinding. Most often, it's the patient's bedmates or those nearby who tell them about it. In other words, you can actually hear it. So this bruxism, when the teeth are active at night, meaning the jaw system is working and the patient is basically chewing in their sleep, putting tooth against tooth and moving them back and forth. The nature of bruxism is very widespread and quite extensive. It's both nervous tension and an improper bite, but that's a separate topic. But bruxism leads to these kinds of defects. The third, rather common reason is our eating habits. Everything related to our daily diet when we consume foods that are too acidic, or let's say products that are overly acidic. This can also include carbonated drinks. This is because the chemical composition of what a person consumes aggressively affects our enamel, and it breaks down in the areas where it is thinner. So, for example, in the cervical area where the enamel is much thinner, acidic foods impact our enamel. The elements that protect enamel from cavities are washed out, and as a result, this kind of chemical exposure makes the enamel much softer and more susceptible to cavities and various changes and defects. And such products I want to emphasize again, especially various carbonated drinks and anything related to these chemicals, especially if you overconsume them, really do affect our enamel and can cause these kinds of defects. The fourth reason includes age-related changes and what is known as excessive load. It is somewhat similar to our bruxism, but here we are talking about age-related changes, of course, changes in our bite itself. That is, when some teeth are missing in the mouth, all the load once again falls on the teeth that remain. And as a rule, even these teeth are not really intended by nature for chewing, right? They are meant for biting off food, for tearing or breaking it, but not for chewing. And it is precisely those teeth, especially, as we often say, our front teeth. The patient chews with whatever teeth they have left. For example, they have no molars and only have their front teeth. Of course, the patient chews with their front teeth, the bite changes, and the load falls on teeth that are not meant for this. And in such cases, wedge-shaped defects can also occur. I would like to emphasize that the most serious and insidious mistake is to ignore such defects. If you have such a defect, be sure to seek help. The doctor may not always treat it right away, but at the very least, the doctor should take a look. And sometimes, such defects can simply be monitored and do not require immediate treatment. But you should still see a doctor, because due to such a small defect, a patient can actually lose a completely healthy tooth, since the location where these defects form is the most vulnerable part of the tooth. And accordingly, as I mentioned, the process very quickly reaches the inside of the tooth, affecting the root. So what should you do if you have such a defect? It's not possible to get rid of such a defect on your own, at home, so to speak, but at the very least, you can and should prevent it from appearing on neighboring teeth, and most importantly, you can and should stop the progression of an existing defect. The first thing you need to start with, of course, is proper toothbrushing. That is, you need to learn to control your toothbrush using only the correct so-called sweeping motions.
Okay, I get that most people brush horizontally, but then why does this defect appear on just one tooth and not on all of them?
There are many reasons, but let's go over the main ones. Horizontal brushing is incorrect because while we do clean the entire surface of the tooth with the brush, we also end up brushing near the base of the tooth where the gum meets the enamel. Anatomically, the enamel is thinner in that area and it's a very vulnerable zone. If we brush incorrectly in that area, the enamel there will wear down even faster because of this improper brushing. Additionally, the gum itself is very delicate, and as we age, it becomes even more sensitive, so it requires even more careful care. That's why the gum starts to recede, the enamel ends, and the cement border of the root appears. In other words, that's basically the root there. This is something patients often notice in their own mouths. Their tooth is actually healthy, the enamel is intact, there's not even any cavity, but they see some kind of yellow line appearing below the edge of the enamel. That's actually the cement of the tooth root starting to show. There's no enamel there anymore, it's unprotected. And of course, cavities develop instantly in that area because only enamel protects the tooth. So this is how brushing affects it. Why, you ask? Doesn't this happen to all teeth? That's also related to brushing itself, or more precisely, to the mechanics of brushing. When we position the toothbrush like this, we're mainly affecting these central teeth. So we don't brush our front teeth the same way, right? But for example, the canines and our premolars, this is just how everyone brushes them mechanically. And so if a patient brushed their front teeth the same way, it would happen to the front teeth as well, but most often it's the canines and the neighboring teeth that suffer. The next thing you can use, of course, is remineralizing toothpaste. Toothpaste that reduce sensitivity can at least help preserve the existing defects, or let's say slow their progression, and they can also have a positive effect on our healthy teeth to prevent this from happening. In other words, use toothpaste with a remineralizing effect. The effect of remineralizing toothpastes is that they contain a special formula that, so to speak, seals our enamel and our tubules to prevent sensitivity, making the teeth stronger. Another important point is working on your habits. That is, you should definitely eliminate from your diet all foods that have a chemically aggressive effect on your enamel. Addressing the problem of bruxism, our grinding or clenching of teeth at night, is also a matter of working on our habits.
I have a similar question like with brushing teeth. If we grind our teeth, we probably do it with all our teeth, right? Why does it appear on just one tooth and not on all of them?
Why do we grind, as you say, or clench our teeth at night, and why doesn't this happen to all the teeth? Here, basically, it's the same situation. The load falls on the teeth that are present. And most often, of course, with bruxism, the patient is already missing some of their own teeth, so all the pressure is placed on the teeth that remain in the mouth. In fact, with bruxism, the wedge-shaped defect can also be on different teeth, on many teeth. There are no specific teeth. Bruxism, this is when two teeth interact, that is, antagonists opposite each other. This kind of influence is constantly happening. So we're pressing, right? And it can also be like this. What tooth is this? It can be most of the teeth or maybe just the teeth you have left. When a patient has very few of their own teeth left, of course, all the load falls on the remaining teeth. In this process, these wedge-shaped defects develop much more rapidly and the gums recede faster. Everything related to bruxism and its occurrence, again, I want to stress that it's different for everyone. But the main thing to remember is that bruxism also leads to these wedge-shaped defects. And most importantly, what exactly should you do if you discover that you have such a dental defect? Of course, the first thing you must do is visit a professional dental clinic or reach out to your specific dentist, perhaps even your favorite personal dentist, to get a proper consultation. What does the dentist do in such cases? Of course, the first thing you can start with is observation. That is, the dentist will examine you and tell you the next steps. The second is grinding, meaning polishing this area and treating it with a special protective compound, so to speak. And third, of course, is filling such a defect when the dentist cleans out the defect and places a filling right there. Sometimes it's necessary to fully restore such a tooth. Very often, fillings don't hold well in these kinds of defects in that particular area, and it's quite common for a patient to have a filling placed there, only for it to actually fall out after some time. So this is absolutely normal. Once again, this is due to a very problematic area. That's why sometimes for such a tooth, in extreme cases, but it does happen and you should be prepared for it, the doctor may place a crown on that tooth. Such defects are easy to detect on your own. The most important thing is to see a dentist in a timely manner so that these defects do not progress and you don't lose a healthy tooth.